My name is Jeff Morley and I'm a psychologist. I'm a recently retired RCMP officer, spent 23 years in the Mounted Police, and now work as a registered psychologist in Vancouver, though I travel all across Canada, working with first responders from all different fields, police, fire, corrections, military, all different folks. And I think in that time I've learned a few things or two about how people cope effectively with the work, what's the risk are to their health. So I hope I can pass on just some brief moments of wisdom around that from what I've learned. And I guess the first thing that I'd say is when I look at the risks to corrections officers, and having spoken with corrections staff of all sorts, nurses, social workers, program people, CX staff from across Canada, what I found is there's some sort of common themes about what's most challenging to them in their work and also to their psychological health and well-being. And I'm going to list those as three basic things. The first is what I call primary trauma. So that's about when staff is the one that's in harm's way, whether that's being punched, kicked, spat on, assaulted, held hostage, all those really difficult things that we deal with, I'll talk about. The second is what I call secondary trauma, which is about the experience of confronting unfixable suffering. So whether that's dealing with a slasher or someone that's hurt themselves in some way, people that are self-harming, where it's that unfixable suffering that can take a toll on us. And the third thing I'll talk about is around organizational stressors, the stuff that goes on in the office and in the organization that could be hard for us to deal with and sort of take a toll on our psychological health along the way. The last thing I'll touch base on is around resilience. So when we talk about primary trauma, so again, when we're the one that's in harm's way at work or in our lives, fists are flying, feet are flying, and we're having that full adrenaline response where our safety's imminently at risk, we say that, for an event to be considered traumatic, it needs to involve a serious threat to your physical integrity or someone nearby you. You could be injured or hurt. And for an event to be considered traumatic, it needs to involve fear, helplessness, or horror. Those are important words: fear, helplessness, or horror. And I think sometimes we can be in those situations where there's a use of force encounter or something goes on, definitely causes the adrenaline response, but not that real sense of fear, helplessness, fighting for your life, or horror that can go on at times. I think those sorts of situations draw out a different sort of response in us, so that while sometimes if there's a threat or something difficult, okay, we can deal with that. There's a situation, we can go and calculate our response. I think there's times when the fight's really on and we're fighting for our life or our life is at risk, that we have a series of instinctual, involuntary reactions in those cases. And those reactions, which I'll talk about, are common to all people, and in fact, all animals can have the same sorts of reactions. So often we hear those terms, fight or flight, fight or flight. So those are the first two I talk about. And I often ask when I'm working with CX or with CSC staff, when I ask about the trauma reactions in the fight, what goes on in the body. And I think what goes on with that fight response is the full adrenaline rush. So heart beating fast, our breathing gets shallow, which if we do that for any length of time can result in people passing out as a result of the hyperventilation. So heart rate, breathing, the blood flows to major muscle groups, fight or flight, arms or legs. So that'll cause an increase in strength and speed. Blood flows away from unnecessary function in the body during a crisis response. So things like digestion, blood can flow away from there. So what can that result in? People may throw up, their bowels may let go, all that kind of stuff can release, which can cause a lot of shame, embarrassment, all that kind of stuff. But important to remember, it's the body being very functional. I don't need to be digesting dinner right now. I need to be fighting or fleeing. So a normal, instinctual, involuntary response that can come about for us sometimes. Then when the blood flows to those major muscle groups, we get that speed and strength, so our strength can really increase. So, the stories of the little old lady lifting the car off the trap kid, it's not just National Enquirer stuff. That stuff really happens. And the other thing I talk about with that is how pain tolerance can go up. So we can become very insensitive to pain. And the reason I think that's important to talk about is after there's been a serious situation, you may ask, a friend or colleague, oh, are you okay? And they might say, oh yeah, I'm fine, I'm fine. It's like, oh, are you aware there's blood pouring out of the side of your head? And they may not be, because the pain tolerance is so high, because we get all the adrenaline, but all the endorphins as well, the painkillers that go along with that. So it's important to ask, but sometimes to respectfully check or have them checked out, because they may not even be aware of how hard they've been, or that they've been hurt. Other things that go on in the body, hands. We can lose fine motor movement. Our hands shake. That's personally one of the adrenaline responses I like the least. I don't like the shaky hands, but that's a normal part of the process. And I actually encourage people, as much as it may feel embarrassing to shake, I had a staff member ask, well, I don't like that. How do I stop the shaking? So the answer to that is actually to exaggerate it. So you may not want to do that in front of an inmate or an offender or when you're out in public, but go somewhere if you can and shake it out. Shake your hands, shake your feet, get it out. It really helps discharge a lot of the adrenaline that's in the system and sort of helps reset some of our brain's neural circuitry. So the shaking, normal, also involuntary, but a helpful thing that we can do to kind of process that in the body. Other things that get us in the body, normal, instinctual, involuntary reactions. Vision. What happens there? Tunnel vision. So we zoom in on something. Sometimes what we do is the peripheral vision gets lost and we'll zoom in on the threat. So sometimes that may be a person, sometimes it's a hand, a fist, a weapon, a tooth, whatever that is, that's in there. And the reason I talk about that tunnel vision is it's also something that's involuntary, and after the fact, maybe we're, debriefing or giving a statement on something and say, oh, didn't you see us over there waving you off? Or didn't you see this person over there coming to your assist? No, I didn't. And it's not because I'm a bad employee, it's because I was locked on with that tunnel vision and not aware of what was going on around me. So we get the tunnel vision, hearing. There's a phenomenon known as auditory exclusion. So sometimes our hearing in those real intense moments, totally offline, can shut down, go, so we can't hear anything. But it's another involuntary instinctual reaction that's important to talk about, because often after the fact, if we're giving a statement, oh, didn't you hear us calling you? Didn't you hear me telling you? Didn't you hear us on the radio? No, I didn't. Again, just because that's what the body was doing where the hearing went offline. The other thing that can get us in trauma response is our language, our speech. We're actually learning from the latest cognitive neuroscience how one of the areas in the brain that gets affected in a traumatic moment is called Broca's region, the area of the brain that has to do with speech. It's the same area that gets damaged in a stroke when somebody can't talk after the fact. And that Broca's region, the gray matter, goes offline. So our ability to speak, really difficult, doesn't come out, words can be garbled or we can't speak at all. So we may be embarrassed by that, but that's again, a normal reaction that happens in the gray matter. Last couple things in those fight responses that can get us is our sense of time. So what happens to time? It slows down. Sometimes time in a real traumatic situation can feel like it's moving in slow motion. And the phenomenon is known as visual slowdown effect. I know for me, I've had that a time or two. It's both times been in car accidents, one a rollover and one a full-on spin, where everything feels like it's happening in slow motion. So again, another example where sometimes when we're debriefing a situation after, oh, how long did it take for help to arrive or for this to happen? You might say, it felt like it took 15 minutes when in reality it might have been 30 seconds. So that sense of time gets distorted for us. So lots, again, normal physiological involuntary reactions that can happen with that fight response, but we may feel embarrassed by those. We may feel ashamed, we may feel stigma, but they're normal. Same thing with our emotions that come out when the fight's on. What's the big emotion that hits us when we're in that fight situation? Usually anger, you know? And while sometimes we may be okay with that, often we may be shocked that such intense anger came out of us. We want to see ourselves as these helpful, sort of gentle people. And even if we're tough, you know, staff, that doesn't mean that we like to see that kind of anger or rage come out of us, but that's often what gets triggered in the fight response. So we may be mortified or embarrassed how aggressive we could become in a situation like that. But again, normal, involuntary reactions to traumatic events.